I'm Christine Petrin. I am the president of DFA, and I'm a med-peds physician practicing in New York City. I'm so excited you guys have all joined tonight.
Hello, everyone, and good evening. My name is Angie Bakke, and for the last 4 years, I've had the privilege of serving as the executive director for DFA. And I lead a team of 4 incredible individuals working remotely across the US, supporting over 27,000 advocates and in all 50 states. So welcome.
We're a little over a month out from the election results in November, and as Angie and I and other DFA members were talking about sort of what to do next, we thought it would be helpful to have a call like this. We have a lot of members who maybe used to be very engaged and maybe haven't been for the last few years and are now like really reinvigorated, want to get involved, want to do more work with us, which is great. We have people who have been here for years and are like just really ready to go and have a lot of the institutional knowledge. And then we have a lot of new folks that have just kind of come out and said, I need to do something. I need to be involved. I need to advocate. Where is a role for me? And we're hoping that the role can be here with us at Doctors for America. I think the election results have really heightened the challenges facing healthcare, challenges that honestly have always been there and that DFA has been very involved in, to try to bring about more reform and advocate on a whole range of issues, which we're going to get into tonight. But really at DFA, we believe that all policy is health policy. And what we want to do tonight is take you through what our organization has done in the past, in our 15 years as an advocacy organization for physicians, and walk you through, what we're planning to do in the future. Our whole goal is to empower physicians and medical trainees with advocacy skills, to give them opportunities to use those skills at both the state and federal level. And that has always been our top priority. So together, we're going to continue to fight to ensure that healthcare is accessible for all Americans. And I'll turn it over to Angie next.
So to know where we're going, we first want to lay the groundwork of what we've been doing over the last year. And thanks to many of you, there is a lot to be proud of.
In this slide, we're showing you how our organization is structured. We went under a big kind of overhaul in 2022 to start thinking about our work in these 3 impact areas. They're sort of like buckets of work that are specific enough that they neatly, like there's some content that fits neatly into each category, but they're also broad enough that there's some flexibility and it allows us to be nimble and pivot depending on our advocates' interests. So moving on to the next slide, the first impact area that we want to focus on is our access to affordable care impact area. I want to highlight some of the subcommittees that we have within this work. The first is our federal and state legislation and regulation subcommittee that works pretty closely with the Senate Help Committee and Senate Appropriations, as well as the House Energy and Commerce Committee. All of these committees have within the last year either asked for our support on bills that their leaders are bringing forward, or they've actually asked us to provide assistance and feedback, and sort of weigh in on changes to current legislation. So there's a couple of things that we've been a supporter on is with the Inflation Reduction Act, Medicare's ability to negotiate drug prices. That's something that could be in jeopardy in the coming year. And it's something that we've worked very closely with Congress to really make sure that they know that doctors support this and are behind this.
DFA also works with coalitions in the 10 states who have not yet expanded Medicaid. Last year, there were several wins with states that expanded to 1-year coverage of postpartum care. And that seems to be like an indicator of a legislature's willingness to maybe take the next step and expand to Medicaid. But if that is the precursor to full expansion, there definitely could be opportunities in Wyoming and in Mississippi, and who knows, if the world goes crazy, maybe even Texas. I'm in DC tonight. We just finished up 13 Hill visits today and also a meeting with the FDA. And they work on user fee acts. And while there, we learned that there is really a strong bipartisan support right now for pharmacy benefit manager reforms. And of course, we are going to continue to work with congressional offices to stop the flow of money that lowers drug costs for insurance companies and leads to higher costs for patients.
Our next subcommittee is the Greed and Healthcare Committee. I know everyone on this call has seen examples of egregious behavior every day that takes the focus away from patients, and focuses on the money and the greed piece of healthcare. This subcommittee was born out of some shared work that was really spurred by Dr. Don Berwick, a former CMS administrator and founder of the IHI. Institute. And this subcommittee is really focused on addressing those issues. We have our Declaration Against Greed in Healthcare petition. If you haven't had a chance to sign that, I encourage you to do so. It's really just a declaration that you are here to take care of patients. You're here to advocate for healthier communities, and you're not here to put profit over patients. And then the final task force that I want to talk about in our Access to Affordable Care group is the FDA task force, which Angie was just alluding to because that's who she's with in DC for this big trip they have this week. But our FDA task force, we provide unbiased expertise to the FDA regulatory process in a way that I think is very meaningful to the clinical outcomes for our patients. So we do a lot of work on clinical trial transparency, post-market surveillance and regulation, drug shortages, and all of that, of course, is through a lens of health equity, and ensuring that drugs and health and medical devices are safe and effective for all of our patients. I'll turn it over to Angie to talk about our next impact area.
So now we're going to talk about community health and prevention. And you may notice the titles of our impact areas are really quite broad. And this was really done intentionally. So we are able to pivot and change to address to the issues that are important to you. And one of the things that I have just really valued during my 4 years at DFA is the fact that the work that we do, it is not from the board down, it is from the members up. And we love that. And the first committee in community health and prevention is our work in gun violence prevention. And gosh, talk about a busy group. We know that there is not, a real appetite to do anything on the federal level. And this group is doing a lot of outreach at the state level, and they are making some inroads. Some of the work includes working on emergency risk protection orders by clinicians to reduce access to firearms. If they are coming in and exhibiting perhaps dangerous behaviors toward themselves or others. Other things that the group works on is, teaching our advocates how to talk to your patients about gun violence prevention. I live in South Dakota. It's a red state. You say gun violence and it's immediately la, 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 la. But it's having that conversation about, giving them real world examples. The fact that, gun violence has now overtaken car accidents as the #1 killer of children under the age of 18. That's huge. And this again is really important about, teaching, reaching out to patients to have those sometimes difficult conversations. And there are lots of tools and resources to give you the words, to give you examples of just how to do that.
Our next subcommittee I want to talk about is the Substance Use Disorder Subcommittee, which is very near and dear to my heart because it's the subcommittee that I joined when I was a medical student, when I first got involved with DFA. So I love the work that they're doing. We have a couple of different things going on in there, a few different toolkits on pain management. We have created some toolkits on how to educate clinicians on marijuana education and counseling, and then also just increasing the number of clinicians who feel comfortable talking to their patients about opioid use disorder. So there's a lot going on in that subcommittee as well.
Now, the last subcommittee in community health and prevention is called Public Health. And this group continues to do a lot of work on building vaccine confidence. As we've seen, pediatric vaccinations substantially decline since COVID. Prior to COVID, anti-vaxxers were sort of like, in the fringes over there. And unfortunately, in the last administration, they were really normalized. So, it's really important to continue to work in that area. In addition, public health has also taken on the tough job of fighting misinformation and disinformation in the public sphere, along with the anti-vaxxers being nominated for key roles in the upcoming administration, which we'll get to in a little bit.
So I'm hoping as we're going through these impact areas, maybe if you're learning about DFA for the first time or you're getting re-engaged, like I'm hoping you're seeing where you think your advocacy might fit in and what role you think you might want to join. And that brings us to our last impact area, which is our health, justice, and equity impact area. This work includes our reproductive rights subcommittee. As you can imagine, this group has been incredibly busy over the last few years working on abortion access. One really exciting thing that I have just loved seeing DFA be a part of is doing more in judicial advocacy, which we'll also talk a little bit more about later on. But we have filed multiple amicus briefs, both in several federal cases, including the Alliance of Hippocratic Medicine versus the FDA. We've also submitted amicus briefs in the district court level, including the Gen BioPro versus West Virginia case, the EMTALA case of Idaho versus United States. We've been working really closely with a team of lawyers at Columbia University in their clinic. They've helped us develop a Know Your Rights guide for shield laws in New York. And again, we're going to talk about this a little bit more, but it's an area of advocacy that I think is really going to become even more important, especially as the years go on. And I'm really glad to see DFA kind of like leading this work in a new way.
Now, the Sexual and Gender Health Subcommittee is especially active and busy during the winter and spring months. Typical state legislative sessions covering numerous bills at the state level that infringe upon the rights of providing gender-affirming care. And we expect even more erroneous bills in the upcoming 2025 legislative sessions. And in anticipation of these upcoming sessions filled with attacks on the transgender community, this committee has created talking points to educate their communities on gender dysphoria, as well as developing an on-demand educational event on, how do you put your narrative together to talk about gender health advocacy? So there are lots and lots of resources, and do check out Doctors for America's website and watch for, ways that different seminars, different educational events that you can attend to learn more about these topics.
And our final subcommittee in this impact area is our Decriminalization and Liberation Subcommittee. This group is very focused on immigrant health justice and trauma-informed care. We've created an incarceral toolkit to support equity and access for clinicians who are working with patients who are in jail or in prison. And then we've also, over the years, had a number of sign-ons and statements that have been to support access to DACA recipients.
Now it's really exciting to talk about this part because I'm really, really proud of the work that you have all done. And these are just a few of the highlights that we'll just quickly run through that, we've done through all of these 3 impact areas that we just discussed. And this slide will give you a little taste of what you're going to see next month in our 2024 impact report. So starting in the upper left corner, you'll see DFA advocates. We were in DC again, and we had the opportunity to visit with FDA's Chief Medical Officer, Hillary Marston, discussing post-market surveillance and FDA advisory committees. Now, the picture with the individuals with signs and DFA advocate, Dr. Cheryl Hamlin, she spoke at a rally with the Center for American Progress representing DFA in front of the Supreme Court the day they heard oral arguments regarding the Alliance of Hippocratic Medicine versus the FDA, which is on access to mifepristone. She was amazing.
And then moving over into the upper right corner, that's me. This was an event that I participated in at the Capitol this past spring. It was hosted by a group called Protect Our Care, which is a great organization. And it was and co-hosted with Senator Amy Klobuchar. The purpose of the event was to talk about the several court cases that the pharmaceutical industry has against to sort of sue against the Inflation Reduction Act. Especially the components around Medicare negotiation for drug pricing. And, I was on this panel. There were some like really smart, they were all men, really smart men, like all with me. Like we had a lawyer, we had an economist talking about like why these lawsuits could be harmful. But I was the only one there talking about patients and talking about patients I've seen and patients I've witnessed unable to afford their medications and like what that means for a human person day to day, and like get away from the graphs and the statistics and really just tell patient stories. And that's, I think, a great image of like what our organization is. It's getting us out of kind of the ether and bringing us back down to the human level and sharing stories so that we can, at the end of the day, help our patients. And then the next one we have is this picture of our amicus brief. This is, as I mentioned, this was our amicus brief in the Alliance of Hippocratic Medicine case. This was actually, our brief was quoted by the Department of Justice and several members of Congress, which was really, really exciting to see. Again, our brief was nothing fancy. It was just stories. It was clinicians saying what they see day in and day out and just sharing the stories of their clinics and of their patients.
Now, moving down, you will see in September, FDA Task Force Chair Dr. Reshma Ramachandran participated in a panel discussion with Senate Health Committee Chair Senator Bernie Sanders. You'll also see, sorry, this is on the left-hand side of the screen. You'll also see a special shout out that he threw out to DFA because of all of you speaking up on behalf of your patients. Now, in the lower right-hand corner, you're going to see the picture post-event from our National Leadership Conference this summer with the White House Office of Gun Violence Prevention, which featured over 50 white coats, 30 health professionals, and the second gentleman, Doug Emhoff. And the purpose of the event was to elevate the critical role that all of you play in combating gun violence. And then in June of this year, DFA's National Leadership Conference, we were right back here in DC, and the goal was to reclaim the voice of medicine. Obviously, that's something we're going to continue to work on, but it was DFA's 15th anniversary year, and it was really extra special to have DFA founder and current Surgeon General, Dr. Vivek Murthy. He gave the keynote address, and he also presented the Founders Awards, which honors the two organizations that now make up DFA today, the National Physicians Alliance and Doctors for America. And again, you will see these and so much more in the 2024 Impact Report. So watch for that coming to your inbox soon.
We wanted to start the night kind of sharing some of these wins and highlighting all of the amazing work that many of you have contributed to. But we're gonna pivot now, because I think the reason that we're really all here is to reignite our commitment to protecting all of our patients and their communities across the country. I imagine many of you have similar emotions over the past month that I have had. And I invite you all to channel that passion and that fear and that outrage into actionable advocacy alongside all of us. We're a group of physicians who all feel the same way. It's a community of like-minded people at DFA, and it's what drew me to this organization in the first place. I mentioned earlier that I joined as a medical student. And what drew me to this organization is that there's inside the hospital, there's plenty of hierarchy. It's very evident who is the lead and who falls below. And at this organization, whether you're a medical student, a trainee, an attending, a retired physician, we use first names. We're all on the same playing field. We all come to the table in an equal place. And I never felt any community like that in healthcare. I never met any group that was so dedicated to just putting their patients first, quite like the advocates we have at this organization. And what I'm hoping we can do tonight is take that energy that I think you guys are bringing, and channel it to move forward. So I'll turn it over to Angie to talk a little bit about where we go from here.
First thing I want to say is we've done this before, right? 4 years ago. So same song, different verse. And as I mentioned, I'm in DC tonight, and I want to share some details of a particularly excellent visit that we had with one office who you would think, well, let's just say they do not share our vision of healthcare for Americans. However, within 2 hours of our visit, I received an email from their top health legislative staffer asking for our positions on nominees for Secretary and Deputy Secretary of Health and Human Services, the FDA Commissioner, the Director of the Center for Medicare and Medicaid Services, and Surgeon General. And also, she asked if we would have any questions that we would like them to ask on our behalf. And one thing I wanted to just bring up, all it takes is 4 votes from either party to help pass or to help tank a bill. So it is really essential for all of us, not just the FDA task force. We need everyone's help with this to continue to expand our relationships. Reach out to members of Congress in your state. Share your concerns about the nominees or whatever is going on at the time. You can also help in this battle by recruiting other physicians and medical trainees to join this community of like-minded advocates. And of course, like Nike says, just do it. Do something. Get engaged. It doesn't have to be on some grand scale. How do you eat an elephant? One bite at a time. And that's how we're going to make a difference in the next 4 years. One advocacy action at a time.
And if you're totally new to advocacy and you're like, I don't just do it, I don't know what to do, that's where DFA comes in. We make it super easy. Like, we will walk you through everything anytime an opportunity comes up, we will kind of hold your hand, walk you through, and then let you fly and kind of be behind you the whole time. So you've got that support. Angie's alluded to this several times already, but I think we all know how important it is to have qualified leaders with knowledge and experience to protect our health and to secure our nation's place as a global leader in healthcare and medical innovation. The president-elect has nominated several individuals for key positions where this does not feel safe or like that's going to be the case, including RFK Jr., who we all have very serious concerns about. In fact, DFA we have already sent almost 800 letters urging senators to reject his nomination due to his combative rhetoric, his false assertions regarding the safety and efficacy of life-saving preventive healthcare like vaccines that undermine years of progress in disease prevention and treatment and really just public health policy broadly. The statements that he has made regarding changes he plans to make to the NIH alone would leave us completely unprepared to face another epidemic and pandemic like we did just a few years ago. And I think as a primary care physician, if there's anything worse than any of that, it would be kind of halting the progress in advancing the care we have for millions of patients who are living with chronic diseases.
With many of the other nominations for key health positions, again, we have many concerns about several of the nominees' lack of experience in leading an agency. And in fact, in one of our legislative visits, one of our advocates said, I'm a doctor, obviously I'm smart, I love what I do, but I am not qualified to lead CMS. And so not having that kind of experience leading such a layered, multifaceted agency, as well as having to make, and implement influential policy decisions, that's a lot for someone. I mean, talk about a steep learning curve. I wouldn't want to do that. And so also, one of the, I think, biggest points, in fact, of things that we really care about at Doctors for America is that individuals who are chosen to lead these agencies should be free from financial or personal conflicts of interest, including, financially benefiting from the changes in policy and regulation, such as, Dr. Oz's previous support for eliminating traditional Medicare in favor of private Medicare Advantage plans. Despite the fact he has a deep financial ties to private health insurers. And that's just one of many conflicts of interest. And what's been particularly interesting, since many of these candidates have been nominated, they have still continued to, promote products and do different things. So it's not necessarily changing behavior.
You may have already seen some of our email blasts regarding particularly these two men, but sort of post-election concern. But in the coming weeks, we're going to have an official position statement on the health nominees for the upcoming administration. And we're also going to provide senators and committees with a list of questions to ask all the nominees, regardless of their party or politics. And then next up on our next slide, this is what I alluded to earlier, our judicial advocacy. Another kind of next step in our path forward is to expand our work in this area. I mentioned our partnership with Columbia Law School, but we actually now have partnerships with 4 law schools across the country. And it's been so exciting to work with all of these young lawyers, just as they're kind of like budding out of school and starting to think about what their practice is going to look like. And in our work with them, we're going to continue to provide you, clinicians, with opportunities to weigh in on amicus briefs, to share those patient stories, and also to help impact the laws that are going to kind of impact the practice of evidence-based medicine, and also weigh in on discussions regarding like a clinician's ethical obligation to provide care, which has come up a number of times in our reproductive health work.
Another important way to influence policies that impacts patients is to interact directly with federal agencies on the regulations that those agencies create. And this area is really a tremendous underutilized form of advocacy. We've dipped our toe in it. We've done multiple comments, but we are going to be doing a lot more. So hold on. Federal law generally provides organizations and individuals with opportunities to comment on the various agencies' proposed regulations. And then, agencies in turn think about the comments submitted on their proposed rules. And in our FDA meeting this morning, we heard they had, it was on the User Fee Act, and they had over 10,000 comments. And they said, we read every single one of them. So before they publish any final rule, they have to respond to relevant and significant comments. And I want to share a real success story that we had with this. And again, this was like early on in our reinvigorated FDA task force. We met with the coverage and analysis group of CMS regarding Medicare paying for the controversial new Alzheimer's drug Aduhelm, which was like the first, new Alzheimer's medication in over 20 years. So the group shared that they had not met with a physician group that didn't have financial ties to the drugs that they were reviewing. They were shocked that it's like, so you're not with some other organization, you're just here on behalf of patients. And yeah, that's what we do. We sent thank you notes to them following, and we had multiple thank you notes back for just saying how much they appreciated hearing our perspective. And what was really great is the final outcome was the coverage and analysis group. They accepted our recommendations not to cover the drug outside of the clinical trials, which actually led to Aduhelm being pulled from the market. And in their decision, some of the language that they released were like actual paragraphs, word for word, of some of our public comments. So it makes a difference.
And up next, we're going to talk about our Reproductive Health Coalition. I just want to make a quick comment. We're seeing the Q&As as they come in, so please keep writing your questions. If I'm going to answer all of them, don't worry. But there's one that just came in that was about partnership and sort of like how are we going to come together with other organizations to defeat these nominations, and like just working outside of DFA, how can we partner? And that's exactly what this slide is about. So I wanted to briefly acknowledge that question before I answered it. Our reproductive health, well, number one, I mentioned our partnerships with Columbia Law School and the other law schools, but we have partnerships with a number of organizations in the public health and in the healthcare space. We came together to help form the Reproductive Health Coalition, which is a wide range of professional organizations that represents over 150 million members. It was co-founded by us and then the American Medical Women's Association. And this is just one example of sort of us as a coalition builder, as a convener of different partnerships. We have partnered with Families USA, the Center for American Progress, the Committee to Protect Healthcare, Lawyers for Good Government, the Committee of Interns and Residents, Democracy Forward, like countless others. I think this is a great example of how that collaboration can turn into something more when we end up creating an entire coalition around one advocacy area. But to answer the question from one of our attendees tonight, we've done it before and we'll do it again. We have a broad range of partners and we're excited to work together to kind of achieve the vision that we have for what healthcare in the United States should look like. And Angie, I'll turn it over to you for the next slide.
You bet. And just piggybacking on what you said with all of those organizations, we are constantly in collaboration because it really takes a village. And we know that, we don't always have to lead from the front. We can support another organization with, testimony by one of you, perhaps white papers. I mean, it's amazing the variety of work that as advocates that you can do. But as doctors and medical trainees, you care for patients across racial, socioeconomic, gender, geographic, and the political spectra. And you give a voice to all of these diverse perspectives and needs that the proposed policies are meant to address. And, in addition, what's also so great is that you can powerfully speak to the values of medical professionalism, and that is to care for all patients fairly and equitably. And it really is that power of the white coat worn by our DFA advocates that we can make a difference in public and policy conversations at the state and federal level. And we are very committed to making a difference. None of us need another meeting to attend, right? And so you want to have impact. And a way that you can do that is by becoming a paid sustaining member. Funding is always hard. It's the bane of my existence, if I really want to be honest. But as far as grant writing, that's what I mean. But you really can make a difference by joining DFA as a paid sustaining member, and you can see the member benefits that are available, including up to 12 or more continuing medical education credits per year, and it's on demand. So if you miss an advocacy grand round session, you can go back, take the quiz, get the credit. And then you can also help through donations. Maybe you can join our Giving Every Month Club, be a gem, or just making a year-end donation. Anything that you are able to do with your time, treasure, and talent is needed and so appreciated.
All right, and on our next slide, we've got QR codes. If you're interested in becoming a member or making a donation, we definitely encourage you to. I'm going to get to our Q&As in just a moment, so please, if you have questions that haven't been answered yet, please write them in the chat. We're not going to have you guys come off mute, so everything's going to go through the chat, so please submit them there. I just want to say our organization started, we were originally Doctors for Obama back in 2008, and our whole drive was to help get the ACA passed, which we helped do. And, we defended it then, and then we defended it again 8 years ago, and we're going to do it again. This is work that we've done time and time again, and we'll continue to do it into the future. And we really want you to help us join that fight. We're all here to help support equitable, affordable, high quality care for our patients and their communities in absolutely every forum possible. You know, we're all doing it every day in clinics and in hospitals. But if you've never advocated before beyond those clinical spaces, I really encourage you to join us. You know, in Congress, the courts, local government, federal agencies, we're really trying to make sure that our hand is in every pot when it comes to advocacy for healthcare. You know, I just want to end by saying our core values are putting patients over profit, profession, and politics, and that will continue to be our North Star in all of these efforts. And I'm excited for all of you to either re-engage with us, join us, or keep up the great work that you've already been doing for so many years. And with that, I'm going to turn to some of our Q&As. We have one that was, let's see, how can medical students get involved with the judicial advocacy and work on amicus briefs? That's a great question. One of my favorite pairings, actually, Angie and I talk about this a lot. I think it's so fun when medical students and retired physicians like team up and work on a project together. I think an amicus brief is actually a great example of that because the retired physicians have these like decades of stories. They've got patient stories. They just are like filled to the brim of narrative. And the medical students have like all this energy, all of, honestly, you know, we're all following the news, we're all up to date, but medical students in particular, like really have their ear to the ground when it comes to like the nitty gritty of policy details. They're able to pay a little bit more attention to that because they just have a little bit more time than maybe a practicing physician does. And when you put that combination together, it's really fun to watch. And it's kind of like the best of both worlds. So as far as the judicial advocacy and amicus briefs, if you're maybe a student, you don't have a ton of stories yet, or you're in your third and fourth year, you're starting to collect them and you're like, I need to share this with somebody, please email us. We're going to have our, do we have our contact information, Angie? Great. If we can go to that slide just with our email address so that you can reach out to us. It's info@doctorsforamerica.org. And we can put it in the chat too so that you have it. Please reach out to us and just say like, hey, I was super excited about the judicial advocacy you're doing. Like, how can I participate in another amicus brief? And we can help get you in touch with some of the law schools that we're working with or some of our main staff members that are sort of the point people for that work. So please get involved. We would love to have you. And let's see, we have another comment. You mentioned the anti-public health views of RFK Jr., wondering if his views on mental health treatment, this horrific sentiment that SSRIs might cause mass shootings, are included in advocacy and question lists for senators. That's a great question. We're still creating those lists and figuring out exactly what we want to share. But yes, this is very much in line with the kinds of questions we want to make sure our senators are asking in the confirmation process, and questions that, more importantly, that these nominees have to answer. If they're going to make statements like this, we want to present them with fact and with truth, and again, with patient stories to combat a lot of the disinformation that they're spreading. So again, please message us and tell us how you want to be involved, and we would love to have you involved in that work too. Let's see, I have another question. Can medical students join the DFA Federal Legislation Committee? Short answer, yes, absolutely. And how can medical students apply to the Capello Health Advocacy Fellowship? That's a great question. So the short answer is if you're a medical student, you can get involved in anything you want to be involved in. We are glad to take you. I started as a medical student. I think it's a great spot to either continue advocacy that you've been doing already or get involved for the first time. But you mentioned the Capello Health Advocacy Fellowship, which is a really great opportunity. And maybe, Angie, I'll turn it over to you to share a little bit more about what that fellowship is like.
You bet. And it was great because during our fly-in for the last 2 days, we had 3 of our Capello Advocacy Fellows here, as well as one of the co-directors of the program. And so every April, May-ish, you will see the application come out in the DFA newsletter called The Pulse, and we do social media on it. And so it is a cohort. This year we expanded it to 16 advocates. And so we have lots of medical students in there. I'll tell you what, the medical student applications were outstanding. So much better than the attendings, just saying. But it's really exciting. And then in July, we make our decision. And then you start typically in August, September. And so during the fellowship, you will be attached to one of our 3 impact areas and the FDA task force. And so you will go to impact area meetings, get involved in that work, learn more about that particular subject, the issues that are in that impact area, and then you get to do a capstone project. And so our capstone projects have been absolutely mind-blowing, because we give our Capello Fellows the opportunity to present them at a luncheon at the National Leadership Conference. And granted, this is every other year we do the conference, but it is still so incredible and inspiring to see those stories. I would encourage you, you will see the accomplishments of the last Capello Fellow cohort in the upcoming 2024 Impact Report. So long story short, whether you're retired, you are totally new to advocacy, and it doesn't matter at what level, if you're a retired person or you're starting at the ground level as a medical student, we welcome you in the Capello Advocacy Fellowship. You're going to learn things about social media, how to do media interviews, dealing with conflict, how to tell your story. I still remember one of our advocates, our Capello Fellows, she started her story narrative by saying, "I became a physician because I hate doctors." And she shared the story of her mother who didn't speak English and just how mean the doctor was to her when she went in because she couldn't afford her medicine. And so how many years later, she is an amazing leader and pediatrician and, you know, just such a wonderful advocate. So please go for it.
I will second what Angie said. I think, you know, at the national leadership meeting that we have every year, it's, you know, we usually, it's during a luncheon that we hear these projects and these capstones. And you would think like, oh, it's lunchtime, everyone's like either chatting or just kind of focused on their meal, but like it's like almost dead silent in the room because everyone is so fixated by the amazing work that these fellows have been doing for the last year. And it's always like one of the highlights of the whole weekend, honestly, to hear about their work. And let's see, we've got another question. Is there opportunities to write op-ed pieces? And if so, will DFA connect students with the editor or the publisher directly? Are there any deadlines? Just to answer that briefly, if you have an idea for an op-ed, we would love to hear it and kind of help you, either if you've written something before and you feel really confident about it, great. Like we'll take what you have and see if there's ways that we can help promote it. I think one of the areas where DFA is most helpful is finding you the connections of other people in your community. So if you're a medical student, let's say that you're in the Houston area where we have a number of DFA advocates, including attendings, you know, we can try to add more, you know, get more involvement in your op-ed so that even, you know, a few more authors a little bit further reach, and try to help you locate what the best avenue is going to be for publishing. I wrote an op-ed with one of our community partners right before the election on how voting is a healthcare issue. So we are no strangers to promoting op-eds and helping you figure out what angle you want to take, who you want to partner with, and then promotion at the end of the day too. Let's see. Oh, and then Angie is sharing, because we had a great Atisha Jefferson, who is one of our former Capello Fellows, messaged us just now, just shared this video of what their cohort did. So this is a message from Atisha Jefferson. I encourage you to like copy and paste that and then watch it later because it's some really incredible work. Going back to this other question, it goes a little bit more about different partnerships with Medical Justice Alliance and other community partners around like we're doing incarcerated healthcare. That fits very well into our health justice and equity impact area. So those are some partnerships and conversations that can happen in that impact area. Angie, do you have anything else you want to say about that particular question?
You know, we've been doing a lot more work in that space. We have just several amazing advocates who either perhaps provide services at, you know, a county jail, things like that. And so we have an incarceral toolkit on how you can advocate for individuals who are in, in those situations. And sometimes, they are not getting the care that they deserve, as just fellow human beings. So there are lots of ways to get involved. It might not be exactly, our work, but if it fits within the guidelines of our impact area, it doesn't mean that we can't do it. We're not going to probably start right now and do a new subcommittee on climate change, for example. Number one, because there are physician groups doing that. And so even, DFA, our main purpose is to teach advocacy skills, because it's not something that I understand that you get training on in medical school and residency. And then we provide opportunities for you to practice those skills within our impact areas. However, if your interest is outside of the work that we do, come learn how to be an advocate, practice skills with us, and then go and be the best advocate that you can be on the things that you care about. Whether it's, I'm going to run for school board. We've had many DFA members run for political office at the local level, at the state level, and even at the federal level. So we are here to service you and to help you be a better advocate on behalf of patients.
And then the tail end of that question was about regarding amicus briefs, which I'm so glad there's so much interest in, because I think it's really going to be important. But the question is, what topics are on the docket? What kinds of things are we potentially going to be needing amicus briefs around? The big pieces of our judicial advocacy and sort of the work that we're doing with these various law schools historically has been around reproductive health. Which is really where we got our start in judicial advocacy and where most of the amicus briefs have come up. Also with our FDA task force and some of the work that we mentioned there. And then, hopefully probably more at the state level, but our gun violence prevention work too. I think those are probably the three biggest kind of buckets of content for our judicial advocacy work.
And one addition, we anticipate coming back. We were involved in defending the lawsuits against pharma in regard to, they were trying to get out of the Inflation Reduction Act provisions that allowed Medicare the ability to negotiate drug prices. That is going to rear its ugly head as probably the next 10 drugs are released. So, and that again is done in collaboration with numerous organizations, different coalitions that we are a part of. And, again, we're a team of 5 total for over 27,000 advocates. So many of our members, our advocates, sit on these coalitions on our behalf, representing DFA. So I mean, there are lots of opportunities to become leaders.
And just to clarify what you said, Angie, we've got 5 paid staff members whose
Yes.
full-time job is Doctors for America. And everyone else is like me, a doctor during the day and an advocate at night. Although I guess I do advocate during the day as well when I'm at my clinical role. And we're all here on a volunteer basis. But like Angie said, there's several 100,000 of us all throughout the country who in our spare time feel so passionately about this work that we come together in our evenings and our weekends and chat with other like-minded folks. Another question came in: how do we go about building relationships with Republican congressional members if we live in a Democratic district? Can we reach out to Republican members from our state to try to meet? Will they listen to us? Number one, here's something that I've learned with this organization is yes, people are very eager to hear from physicians and to hear what your stories are. I think one way it's most impactful if you can meet with your representative. And so even if you feel like you're pretty well aligned already, there's always something where you can either bolster their opinion or their vote on something with some additional information or stories, or maybe sway them a different way if you feel like that's ever necessary. One way that I feel like this could be particularly helpful, I lived in DC before when I was in residency before I moved to New York. And it often felt like I didn't really know who I was supposed to advocate to. And so I just would go with Angie, go to the FDA, go to CMS, go to these federal agencies and talk to people outside of the legislative branch. And that was so enjoyable for me. And again, they were so kind of shocked that I was there. And I think that it was always a very fruitful conversation. So I think I would maybe encourage you to, not give up on your own congressional folks just yet. See if there's opportunities to build a relationship there, but then also think about stepping outside of that particular branch. What can you do in the way of executive branch advocacy? Because there's a lot there that I think as an advocacy community, not necessarily DFA, but like advocates as a whole, have really neglected for a long time. And I'm excited to see us do more in that space.
And I would add that, that really was a great question regarding, reaching out to your members of Congress, regardless of party. And we've seen success in that. We've heard stories advocating at the federal level, for example, that the stories that you share have changed minds and changed hearts and changed votes. So it does make a difference. I see the question on, do you work with physicians for a national health plan? And if I could say, answer that one easy, yes, we do. In fact, they just did a fantastic presentation for us in June, I think, on Medicare Advantage. And so again, we collaborate with lots of organizations. Sometimes we get, they are single payer. We get a little flack because we're not just single payer, or we're not just Medicare for all or expanding ACA. And Christine, my understanding has always been that DFA will support things that make sense, that provide people access. I'd rather have 50% of something than 100% of nothing. And so sometimes those incremental advances, they're good, and they do
Yeah.
make a difference.
Historically, we have not backed one particular approach to achieving a better healthcare landscape in the United States. I really view our role really side by side with PNHP, in that like our job is to help physicians advocate. We give them the tools, we give them the opportunities, the resources, and then we introduce them to these partners to go out and do that kind of advocacy. And so that's what I see our role as, is really equipping you to take on the issues that matter most to you. If that does happen to be a national health plan, like a single payer plan or a Medicare for all plan, then hopefully you can use some of the skills that we are able to provide you with here at DFA to do some of that work for yourself too. We have a question about skill set for medical students or physicians to get involved in expert witnessing or even utilization reviews as it relates to the disabled. No, I don't know that we have much in the way of kind of expert witness training. I think that's a very important skill set, but I would be happy to talk more with whoever this is another time or offline. But I think our main focus has always been focused on the patient, and how we can kind of make their experience, number one, more accessible, equitable, and affordable. And so we haven't often done much in the way of like individual expert witness type things. Any other questions? We're almost at the end of our hour together, but I want to make sure everyone has has time to, share any remaining thoughts. And again, I want to put, Angie, can we put our email address in the chat so that people can write it down? And perfect. That's that web link there is the best way to get in contact with us. Again, I'm Christine, and that was Angie. We're happy to talk with anybody anytime. If you've got any ideas or suggestions, areas for improvement, or just something you're so excited about and you want some support in, that's really what we're here for. It was really wonderful to be here with you all virtually tonight. I'm hopeful that we can kind of take all this energy and really, move forward into 2025 with sort of a renewed sense of energy and passion. And I'm hoping to see you all again in the short future. Okay, so we've got our email address there and also our contact form. But thank you all again. I hope you all have a great rest of your night.
Good night, everyone. Thank you.